Good morning, everyone. And do you want to start recording, Habib?
Starting, Jack.
Fab. So thank you so much, everyone, for joining at 9 a.m. on a Monday. It's not the nicest day. It's very early, so thank you very much. I'm a new face for you all. My name's Holly. I work within the Covid-19 team at Birmingham Public Health. You'll probably be seeing a lot more of me over the coming weeks and months, but it's lovely to meet you all. Before we get started, a couple of things I just wanted to talk to you about. So the first one is that on social media, Birmingham Public Health have their own account. So it's separate to the councils, and it's called Healthy Brum. It's a fantastic way really to keep up to date with public health issues. We particularly share really good local information in regards to COVID, which you could ultimately share and pass on to others. So if you don't follow us already, we politely recommend that you do. It's a really great resource, and I will share in the chat box now with you how you can follow us. Just bear with me. There we go. Secondly, the COVID-19 NHS app, it has a lower uptake nationally than we would like. So please encourage people to download it onto their mobile phones or if you haven't already, please do so. It's a really important tool that helps to keep us safe. It's stopping the spread of the virus. It's not tracking you as an individual. You can download it by going to the App Store on your Android phone or into the Apple Store if you like. Make sure when you do download it that the contact tracing button is switched on. It just helps to keep the device more accurate, essentially. If you need any sort of help downloading it or any further instructions, please email us, and we're more than happy to help. Just some quick housekeeping. So please use the chat box throughout the webinar today. There will also be time at the end as well for a quick Q&A if you would like one. As much as we love to see your faces as well, or I probably will when Hamira starts talking, I'll switch the videos off and put you all on mute. It just eats up the bandwidth otherwise, and we want to make sure that we can hear Hamira well. So yeah, I'll introduce Hamira. So today we have Hamir Sultan, who is a consultant in parks and neighbourhoods within the Public Health Division. As well as this, since COVID-19 occurred, Hamira has been looking after education settings as well, which is what she's here to talk to you today about. I'll hand you over to Hamira. So she's going to do a short presentation about the pressures that education settings face, and ultimately what we can do to help relieve this pressure. As I said, if you have any questions, please put them into the chat box throughout the talk. And yeah, I'll hand you over to Hamira. Morning, Hamira.
Good morning. Hi, Holly May. Good morning, everybody. And just, yeah, a huge thank you to everybody who's joined us on, as Holly says, on a Monday morning at 9 a.m. I think we've been quite overwhelmed by the response to the COVID-19 champions. And, this is, it's fantastic to see so many people here today. So, yeah, a huge thank you from me as well. I do have a 3-year-old, so that is a 10. So he might pop onto the screen. He's called Issa. So yeah, he's become quite a sidekick for me during COVID-19 and my job. So okay, folks. So I'm just going to spend probably 10-15 minutes talking to you about kind of a bit of an overview about education in terms of the city as a whole. And as Holly says, even though my day job is, well, I was recruited to help embed the value of green spaces across the whole city. Something which is still really relevant to COVID-19, I would say. So I'll probably talk a little bit about that as well, especially in terms of children, because we know how important it is for kind of mental health, helping people to get outdoors and use the 591 parks and open space that we have in Birmingham. I'll talk a little bit about that as well. But I'll talk you through some of the pressures, some of the issues that are coming up that head teachers are facing, that are telling us that are happening again and again and again. And if you can find some way of kind of, I guess, thinking about that as a group of COVID-19 champions and how you might tackle that in the community, that would be fantastic. So just to kind of, I guess, start us off, in Birmingham, I'm sure everybody here knows we're the large local authority in Europe, and we have 443 schools in the city. You know, most local authorities, they're kind of working with 100, 120 schools. We've got 443. That includes mainstream, 27 special schools as well. It includes both local authority maintained and academies. We've got over 1,200 early year settings. So I remember when I was first told this information, it took me quite a while to process this actually. Just that the sheer volume and the task ahead of us to keep all these settings as safe as possible. So by early year settings, we mean registered childcare providers. So they could be local authority nurseries attached to schools, they could be private nurseries, they could be childminders. So we've got 1,200 of those in the city. And then in terms from a post-16 setting, if it's a sixth form attached to a school, that would be counted with 443, but we do have separate colleges as well. And we also have training providers who provide work experience and kind of on-the-job experience to those who don't want to necessarily follow a pure academic route. We've got over 40 as well. And then we also have obviously universities. Birmingham is a really large university city. So we have 5 large universities, but we have recently discovered kind of 3 or 4 more as well. So we're talking about 9 universities as well, and that we know of in the city. That's just to give you a bit of an overview as to kind of, you know, in terms of me, my job is to really liaise with these settings, ensure that they understand what our current processes are, that they have a route through to public health to make sure any queries are addressed. And of course, you know, we've got our Covid-19 team who work with them on a day-to-day basis, dealing with, you know, how to deal with positive cases or the symptoms and isolation advice and so forth. That's one message to try and get across, is it's so important that, you know, we minimize the amount of contact we're having with other people. People might say, well, kids are going to be at school all day with their friends and their other students, and then, you know, as soon as they get out the school gate, we're saying not for them to mix. The reason why schools are back is because it's so important for their education. We absolutely believe that school is one of the best places for children to be at, to be learning, to be developing their, you know, their knowledge of the world, of the environment, that they're still maintaining social relationships with their friends and their peers, which is really important at that age. So we're absolutely accepting, and that's why kind of the reason that I'm here is to try and make sure that education and that social mixing happens in the safest possible way from a COVID-19 perspective. I'll talk to you about that as well. And then it feels a bit counterintuitive. Well, why can't I then just go around to my friend's house afterwards as well? Why can't we just meet up? Because obviously, you know, those school children, when they go into another school child's house, they're not only mixing with the actual school child they were with in school, they're mixing with their entire family as well. So, you know, we need to get that message home as well with families, is yes, they're at school together, but that's the only time they should actually be physically together. All other times, you should only really be in your own household at the moment. Other things that kind of schools are struggling with is that they know that, you know, parents might have tested positive. Well, parents have tested positive for COVID, but children are still coming into school. So again, another message that isn't quite getting through is that if anybody in the house tests positive, the whole house has to isolate, regardless of whether anybody has symptoms or they've tested positive themselves. The whole house has to isolate from 14 days. 14 days from either when the symptoms started, or from 14 days if they were asymptomatic, 14 days from when the test from when the test was actually given. That's a really important message. We know because, you know, within the school communities, we know parents talk to each other of certain people testing positive before the school possibly as well, and the school would really welcome that kind of informal feedback as well, I think. You know, because it can take a little while for the formal communications to come forward. And also, some people aren't telling the school as well that they're testing positive. There feels to be a stigma, I think, emerging around COVID-19. You know, that if I test positive, people are going to blame me for getting COVID because I've done something wrong when I shouldn't have done something wrong, and all this kind of stuff is kind of feeding in to it. And, you know, again, another message would be really important is, you know, if you test positive, that's a massive step in terms of helping to combat COVID-19. Because if you know you've tested positive, then you know you've got it, and there's something you can actually do about it to try and minimise your spread to other people. that's another message that I would ask for the COVID-19 champions to kind of take forward, is that, you know, if you've got symptoms, encourage testing, nothing to be ashamed of. And if you test positive, you must stay at home, and the whole house has to stay at home. And I know there are problems for people in terms of isolating, especially if there are other adults in the house who work, worried about losing their jobs. But you know, there is financial assistance in terms of COVID-19 if you are isolating. So perhaps, Holly, maybe we could put that in the link as well in the chat in terms of kind of what that kind of assistance is. You know, I think, you know, at the base of it, you know, people want to do the right thing. You know, people want to help stop COVID-19 spread, but their circumstances might make it very difficult for them to kind of act in that way. So it's the more help and support we can give them around that's really important. So we've talked about two things so far: household mixing, trying to reduce that, encouraging that, you know, making sure that those who are testing positive stay at home, including the whole household. So if we've got any children whatsoever that go to a school in that household, they should not be at school. Again, symptoms as well. If somebody has symptoms, again, the whole household has to isolate. So any persistent cough, temperature, or loss of smell or taste, any of those, the whole house has to isolate. Because what we are finding is that, you know, if parents, you know, did have symptoms and they did test positive and their children have been at school in that time as well, obviously children could be carrying the virus and be spreading it to other people in the school setting. So again, it's really important to get that message across as well. And something that I should also add is it's now formally in legislation, and it's part of the COVID-19 regulations, that anybody who does test positive should be isolating, and if they're not isolating, then that is actually a criminal offence that could be fined. So equally, anybody who has been told they are a contact of somebody who's tested positive, whether it's through NHS Track and Trace, whether it's through the app, or it's a conversation with Public Health England, and they're told that they have to isolate. Again, if they don't, then that can also be reported to the police, and also it could, and if the police did choose to check, I'd literally knock on the door and they weren't at home, they could again be fined for that. And again, you know, just to make the point, nobody wants to go down this track. Nobody wants the people getting fined. And again, I hope you don't. This isn't coming across as me, you know, type everybody just to report everyone, you know, regardless. I just want to make sure that you guys know what tools are available to you as champions, but obviously to try and use other kind of other means that you have, you know, conversation, you know, those kind of tools of persuasion as well. And I think also probably another thing that we also are seeing is a lot of anxiety as well in some parents, and I guess that's then also probably absorbed by the children as well, as we're getting people without symptoms getting hold of tests, and, you know, kind of testing to see if they've got COVID and so forth. And you all probably know that, you know, testing, I think we're in a much better position now nationally in terms of tests that are available. Even in Birmingham now, we have a lot more testing sites available compared to when we first went into lockdown. You know, the team working on that's worked incredibly hard to get to a point where we have a lot more capacity in the system. But it's still important that the message is, unless you're told by an official organisation to get tested, or unless you have symptoms, you shouldn't be getting a test, really. They are still a finite resource. We haven't got you know, a bottomless pit that is available in terms of testing capacity. And, you know, it's really there for those people who do have symptoms. They're the ones we're most concerned about. So again, to try and get that message across to the community is, you know, get tested if you really need to. It's you know, but I understand for a lot of people this is really anxious times, especially if you're from a certain risk group, an older male with pre-existing conditions, especially from a BME background as well. People who are living with those more vulnerable people are really concerned about passing it on to family members and so forth. Completely understand that. But again, the message is still that only get tested if you have symptoms. So we've talked a little bit about kind of just how big education is. Talk about some of the issues that education are kind of grappling with. Just to give you a bit of an idea of some of the things that education is to kind of tackle. trying to minimise the spread of COVID-19 in terms of within the setting. So most of our schools, early years, post-16 settings will have staggered start times. So you won't have a massive deluge of, you know, hundreds of children trying to get to school at the same time. They'll have different entrances where possible as well, in terms of, you know, certain year groups going in through certain doors, so that there's minimal mixing when they kind of get into the school. A lot of schools are schools and early years settings are operating in these things called bubbles. So bubbles are kind of where I try and imagine it as though you're kind of blowing bubbles out of those little things that you kind of dip into fairy liquid and blow, kind of. It literally is, that's how I imagine it, really. And everybody, I've got 3-year-olds, so we blow a lot of bubbles. So I kind of imagine that everybody that is, you know, you would fit all the school, all the pupils and their teacher into that little sphere there. Nobody else should really come into that bubble, no one else should really leave that bubble to join anybody else's bubble. So, and the idea is that, you know, if anything was to happen in terms of COVID-19, a positive case, then immediately you know who the individuals are that could be at most risk of having that COVID-19 passed on to them. So some schools also will have seating plans. Doesn't work for little kids. You know, my little boy, he's at nursery, and you know, he's just in his bubble. He's talking to everybody, and the staff also in very close contact with them, with the students. You know, these are children aged between 6 months to 4 years old. Need a lot of contact, reassurance if they fall over or if they're upset about something. So we accept that in those situations, if any of those children were to get COVID, that entire bubble would need to kind of isolate, because you can't control or keep tabs on who's been in touch with who. Older children, definitely I would say by secondary school. We're seeing in some primary schools that they're able to put seating plans in. Because if you know exactly where the children have sat down, then you can actually draw a bit of like a noughts and crosses almost, in terms of who was within 2 meters of that individual right at the centre with COVID, to be able to help minimise the number of children that you're having to isolate. Of course, schools would also need to be aware of who they're playing with at break time, lunchtime, who they're socialising with. So we are relying on a lot of honesty here as well, in terms of being able to say, who I've been in close contact with. And if schools aren't sure that they can say that with you know, real confidence, then we would say to them, do you know what, the whole bubble needs to isolate. Other things that settings are doing as well is around, obviously, you know, they have really strong communication with their parents and stuff as well. A lot of our schools have text messaging systems that can kind of, you know, immediately notify parents of when an issue is there in terms of COVID and not to come in and so forth. So from my perspective, I feel very, very assured that the vast majority of our schools are doing a great job in terms of trying to minimise the spread of COVID. You know, there's hand sanitizers there, certain year groups will be using certain toilet blocks and so forth. So from, you know, I caring within a school setting. So when we hear of schools with the kind of 10, 20, 30 cases within, within a school, a lot of goodness, that must mean that the school isn't taking COVID-19 seriously. And this goes back to one of the very first points that I made, that, you know, it's what's happening outside the school, what's happening in the community, the household mixing, kids meeting up outside of school, not wearing masks. I should have mentioned that as well, is that, you know, children in secondary school are wearing masks in communal spaces as well. It's kind of like they have a mentality when they're in school, but the mentality stops when they're outside of school. And actually what the school can do in that situation, they cannot control what goes on outside their school boundary. And that's where you guys come in as our COVID-19 champions to try and tackle some of that. So most of what we're seeing, we think, in terms of education settings and COVID, is most of the COVID is coming in from outside, from the community, coming into the setting. Just to give you a little bit of an idea of, it's a little bit of an idea of just kind of scale. So we have something like 200,000 children in education settings in Birmingham. That is the size of a small local authority in other parts of the country. I think Solihull holds about 200,000, but we've got that many kids in education in Birmingham. And we've had less than 1,000 children test positive in an education setting. So that number itself is large, 1,000, yes. But compared to how many children we have, it's a very small proportion, and that to me is testament to kind of really how well the schools are managing the spread of COVID inside their settings. We've got about 800 staff isolated, about 800 staff within those settings as well, testing positive. So again, you know, we have hundreds and hundreds of staff managing schools, you know, supporting schools, from cleaners to the teaching assistants, all the way through to the teaching staff, to the head teachers and so forth. But again, just to give you a bit of an idea of kind of scale there as well. So I'm conscious that I said I was going to talk 15 minutes, I thought for a bit longer than that. Just one last thing I wanted to say to you was really about the role of outdoor spaces. We're trying to really encourage our schools, our education settings early years to try and use outdoor spaces where they can. Some of you might not have been aware that 591 open parks and open spaces are available in Birmingham, and you know, most places have got not everybody, but a lot of our schools will have parks and open spaces, you know, within walking distance. And I think, you know, it's really important to be kind of getting that message through to them. You know, being outdoors is much better than being indoors. Ventilation perspective, you can spread out more. The risk of COVID transmission is much lower. So that's something that we are trying to share with schools and early years at the moment as well. That's with my green space hat on. But also as a community, you know, getting people outdoors for their exercise, just some personal reflection. You know, since lockdown, I've been going out nearly every day for runs, jogs or walks with my little boy or my husband. I've really seen the demographic change in the last 6 to 9 months. I'm now seeing people of all colours, ages, backgrounds using our local parks and open spaces. Yesterday, it was so busy, we were having to give way to each other to be able to kind of pass along the path. And that to me is fantastic. And I think as COVID-19 champions, you can also spread that message, is, you know, that one of the few things we can do at the moment is use our parks and open spaces. One of the few things that we can do to improve our mental health and well-being is to get outdoors and take in fresh air, connect with nature, see, you know, autumn is a fantastic time of year for colour. And, you know, I can't really tell you just how much better it makes you feel just instantly when you're outdoors compared to when you've been stuck inside all day. Of course, if you're isolating, you shouldn't be leaving the house. But if everybody is fit and well and healthy in the house, please encourage them to get out and enjoy some fresh air and get some exercise. Right, I'm going to stop talking there, Holly. So I'm very happy to take any questions, either from the chat or anybody wants to pop the camera on and ask me. I'm very happy to do so.
So I've noted down, whilst you were talking, some of the questions that were coming up in the chat and the themes. One of the themes has been around, I guess, the process within school. So let's say a child tests positive. What process would the school go through in that situation, I suppose?
Okay. So if a child tests positive, they'll either find out from Public Health England, but most often they will find out from the actual parent. You know, most of our schools have really good relationships with their staff, with their pupils, with the parents. So they do rely on that as well quite a lot. So once they know the pupils are tested positive, we've devised a checklist for schools to ask a whole load of questions about the school layout, about which year group the child is in, understanding if they had symptoms, when the symptoms started, when they were tested, when the result was, who's in their bubble. So they'll answer a whole load of questions on a checklist, which will then get emailed through to us in Public Health Birmingham. And then we have a triage system in Public Health Birmingham. We'll be looking at we get over 100 notifications a day, I would say, about various issues, not just in education, but across, you know, workplaces, other settings, care homes. So yeah, it's a very busy team. But we'll use that checklist to help us triage which school needs the most help. So some of our schools are excellent in that they really understand the process because they've been there before. So they'll know if their child tests positive, if they're, you know, that child hopefully will already be at home because they'll have symptoms or they'll be isolating. But if you know they were asymptomatic, they might still have been in the school setting, and then they'll have a process. You know, we've got a flow chart as well that the school follows. If somebody needs to go home straight away, they'll go into a separate room with a member of staff who'll be wearing PPE, or keeping at least 2 meters away from them, and then they'll be waiting there until the parent will come and collect them. Also, the school will then start to kind of work out who in the bubble needs to isolate as well. They'll be looking back to see, was there a seating plan? Was there, or if there wasn't, who actually counts as somebody in the bubble, as a close contact? And then they'll start to make arrangements for those children to be taken home, potentially early if possible, or if not, definitely by the end of the day as well. So there's a really robust process, I would say, now in terms of how a school manages that. And we've got over 300 schools now that have had a positive case. So there's still about 100 or so to go that haven't. So the vast majority have been through the process once now, and I'd say are pretty good at it. Hopefully that helps answer the question.
Yeah, so there's one that's also a little bit similar. So Sunita said, my son's school received a Twitter message late Sunday night yesterday that the whole school was closed. Not sure why they couldn't notify the parents earlier. Do they have to wait for public health to authorise closure? I'm not sure if you could help with that one.
Right, so it depends what the closure is for. So public health would only ever advise closure related to COVID-19 transmission. So let's try and go back to a point before COVID, if we can find a space in our brains for that. So this time last year, probably a lot of schools were dealing with norovirus. So, which is, for those of you who haven't experienced it, count yourself very lucky. And but essentially it's projectile vomiting and diarrhea, which is pretty horrendous and extremely infectious. So often, in order to be able to kind of rid the school completely of norovirus and give it a really good deep clean, and to try and get space between the students, advice schools would be closed for kind of that kind of situation. With COVID-19, actually, we haven't recommended. I think only once have we recommended the school close, but that was back in July, the very early stages, and it was a special school as well. So very few students were actually in the school, so it made sense to close it to be able to kind of give it a really good deep clean and so forth. But as far as I'm aware at the moment, we're not really advising that a school closes based on COVID-19 transmission. Most of the issues that are happening now is because of the, all we're giving advice on at the moment is who would need to isolate. So, but obviously by isolation, it means certain staff would probably have to be away from the school. And if a school feels that they can't stay open operationally with, a certain number of staff because so many are isolating, they would then most likely decide to close on health and safety grounds. That wouldn't need to be authorised by public health. That would probably be down to the governing body in the school. I'd have to say, I'm not even sure if DfE get involved in that conversation. They might do, but it's not a public health kind of decision at all. And I think in terms of the delay, perhaps in getting to you, it might just be because the schools have been trying to work out, really kind of say, well, can we stay open, with this many staff if we have them in this kind of area and so forth. And I imagine the school's been going through a whole range of scenarios to work out if they can stay open, because, schools want to stay open at the moment. That's the clear message from their Prime Minister and the government, is that they should stay open. So I imagine that's probably why it might have taken a little while to get through to you, that message. And of course, I don't know some of the systems that the schools use for kind of text messaging and things and stuff as well, whether it's an instant message or kind of it takes time in the system for it to get it out to you and so forth. So yeah, hope that helps.
Thank you. And sorry, I'm not missing out anyone's questions. I'm just trying to group them in a way that would make sense for Hamira to answer them. So the next one, Tina says, if a child tests positive, it's very clear cut that they need to isolate. But what if you know that your child has been in contact with someone that has had COVID or has COVID currently, or perhaps you know that a child in their class has got COVID? Sort of what is the guidance?
So you should be notified, Tina, in this case as the parent, is if your child has been a close contact. And the definition of a close contact is very, very clear. So, it's within 2 meters, of somebody, less than a meter for 1 minute at least. So, and that, that is, especially if they've coughed on you, sneezed on you, you've had a face-to-face conversation, or if you've been within 2 meters for any amount of time, that would, or if they've shared a car with somebody who's tested positive, it's possible to keep within 2 meters in that situation, unless it's a limousine possibly, but I think there's very few of those situations probably in Birmingham. So you should be notified, Tina, if your child is a close contact of a positive case. But I'm guessing the question maybe is, is if you haven't been contacted, but you believe that your child is a close contact. If that's the case and the positive case was in the school, I would recommend getting in touch with the school and having that conversation with them. So it might also be that you're aware that your child or another child was within close contact outside of the school setting as well. That's really important. The school will only be thinking about contact within the school setting. They won't necessarily be thinking about contact outside of the school setting. So if you know that you've been in close contact, if your child's been in close contact, then absolutely I would say it's the right thing to do. As long as it meets that definition. You don't want to be isolating unnecessarily, but equally you don't want to not isolate because no one's told you either. If I give you a personal example, if I may, Holly, just of a situation that we were in personally. So we've now got 4 members of my family with COVID. And one of my uncles, he's got severe health problems, and COVID had kind of rendered him unable to use his legs, and so he couldn't get to the toilet. And I'm getting quite detailed here, but his wife is he's a 16-stone man, and his wife is tiny and couldn't manage it by herself. So my dad stepped in and helped to get my uncle to the toilet. So obviously there was kind of direct skin-to-skin contact. He was within 2 meters. And my uncle tested positive for COVID, was taken to hospital. But my dad actually didn't get a phone call from Test and Trace or from anybody to say to isolate. Instead, he called me, my dad, because I'm his public health expert locally. So yeah, which I don't mind that at all. I'd rather people call me than not. And we had the conversation. We went through that. I asked him exactly what did you do, and we went through it all step by step. And I said to him, you know what, you definitely fit the definition of a close contact. My mum, on the other hand, kept 2 meters the whole way, and she was adamant that she had. And I know my mum, and I know what she would have been like in that situation. So so she wasn't isolating. But my dad then took that decision on my advice. That yes, he was going to isolate for the rest of the 14 days from when my uncle, had the positive test. So even though we have a track and trace system, it's not perfect, I have to say. It's trying to capture as many people it thinks are contacts of positive cases. But I guess, of course, with my uncle testing positive, probably would have had his phone number in track and trace, but if he was in hospital, then he wouldn't be answering his phone. So how would we be able to get hold of his contacts from him? So so in that situation, I'd say yes, it's better to isolate than not. So it's quite a long-winded way, but I wanted just to make sure that we kind of covered kind of the different scenarios possible with that.
No, that's fine. And I guess that also ties in with what I said at the beginning of the call around Covid-19 contact tracing app. Obviously, we know Test and Trace isn't perfect. Obviously, we all wish that it was. But even if you download the app but don't have the Bluetooth contact tracing setting turned on, it definitely won't be as effective. So I guess that's one thing for you, I guess, to all go away and check that you do have that setting on, because it's really important. Another thing that we've been asked about is masks within schools. So can you say a bit more about children wearing masks? Do they wear them in school? And do they need to wear them out of school? Is it still for children over 11?
Right. So any child over the age of 11, so if they're in school in a communal space where they're not with people in their bubble, they absolutely should be wearing masks. Unless there's a reason why they can't on health reasons. They've got breathing issues and things and stuff. So, and they would that would, I would imagine, be most likely advised by their GP. In terms of being outside as well, so if they're in a shop, again, the mask, the face covering, wearing a mask is really important when you're likely to be in close contact with people in an enclosed space who you don't know. That could be in a shop, about buying some food. There's very few places now, probably because of lockdown, that would be open in that situation. But you know, I would say probably shops are the things that are open at the moment, you know, that sell food and essentials. And if an 11-year-old or older is going to be in that space, they absolutely should be wearing a mask. The reason why we don't really recommend that younger children wear masks is because they can't stop fiddling with them and touching them and, you know, messing with them. And really, once a mask is on, it should just stay on. You know, the whole idea of it is if you have COVID without knowing, it should stop some of the bigger droplets from coming out from your mouth. It won't stop the tiny particles from leaving, but it will stop larger droplets from leaving and be kind of caught on the mask. And then if you're touching it, you're going to get it all over your fingers as well. Then you touch something else, even though we know that the transmission now is much more likely airborne than it is from touching something and then touching your eyes or your mouth or your nose. It's still a risk. So yeah, just to kind of reiterate, 11 years plus should wear a mask in school communal areas, or when they leave their bubble, they leave their classroom, and they're kind of in the corridors. And if they're in an enclosed space, let's say on a public transport, or they're in a shop where they don't know people, they should be wearing a mask there as well.
Thank you. Another question around, I guess, well, anxiety in general. It's a very anxious time, whether you're a parent, a head teacher, a child. Are there any ways to reduce anxiety amongst children? And another question that was around funding. Has there been any funding for mental health and anxiety during this time? Has anything been released or anything like that?
Funding has been released by the Department for Education, absolutely, and that's been shared with all our schools. So it's you know, whether they're taking it up or not is a different matter, but definitely there has been some funding made available for that. We recognise currently that COVID-19 is it's playing havoc on people's lives, even if it's, you know, people haven't got COVID. The way in which they're living their life because of COVID and trying to reduce the transmission, it's really, really tough. And unless you've got a lot of resilience to begin with, it can be even more difficult to cope with this. So in terms of how to reduce anxiety, you know, we know that children don't spread or transmit COVID any more than adults do. See, some of you might be familiar with seasonal flu. You know, children are often termed super spreaders there in terms of seasonal flu. They don't really suffer with it that massively themselves. That's why we now vaccinate children against seasonal flu, to try and minimise them giving it to others. But that doesn't seem to be playing out with COVID so much. So, you know, children don't need to feel that they're kind of, you know, a big, like, might be kind of going into some issues around, you know, people feeling that, you know, they might be to blame for spreading it to other people in their family and so forth. But I would definitely make that point as well, is that, you know, children are no worse than adults necessarily, that we think at the moment in terms of spreading COVID-19. And I guess, you know, it's, in terms of how else you can manage that anxiety, it is to say that we're not going to be like this forever. It's not going to last forever, the way in which we're living our lives right now, and that children are having to kind of be selective about who they see outside of school or they play within school and so forth. We are getting closer to a vaccine and so forth, and yes, there's still a way to go with that. But yeah, those are the things that kind of come to the top of my mind, really. But I'm sure, you know, and probably Holly May, we could also signpost our COVID-19 families, all the mental health support that we put on our website for Be Active. Sorry, for Be Healthy. Sorry, we've got lots of ways. You know, we've commissioned quite a lot of people to help support young people in terms of their mental health as well, through kind of videos and online activities and so forth. So that's
absolutely
as well. And to go back to the point, green spaces. We know that being in green space reduces anxiety, reduces stress. We know that it's really good for you. So just to get them out playing outside, outdoors, in a park, just, you know, going for a walk, it will make them feel better. Not in a necessarily kind of, you know, moment, it will help. So I definitely recommend that as well.
Someone's popped in the chat about a really good resource called Kooth. They are an anonymous mental health chat line for anyone under 25 who perhaps is struggling. We also have similar type resources listed on our COVID-19 pages. So I'll pop a link into the chat as well. There's a list, I think, of multiple different sort of helplines or charities that might be able to help and assist. So I'll pop that in the chat now for you. I guess going back to the green spaces question, so somebody raised, and it's quite funny actually. So a personal experience, I love going for walks, especially during this time when we're obviously in lockdown. We are able to do exercise and go for a walk, which is wonderful, and it's the one thing that I look forward to really. But I went to the Licky Hills on Sunday actually, and it was so busy. Before I got out of the car, I was thinking, oh my goodness, like it's a lot busier than I expected. And somebody has asked a similar question in the chat. We do to protect ourselves. And I guess the main thing I want to say here is that it is so much safer to be outside than it is to be indoors. And obviously if you follow hands, face and space, and you're always 2 meters apart and you're washing your hands, you really are better off to be outside than you are to be inside. But is there anything else you wanted, I guess, to add around that, Hamira, about how, be busy, perhaps busier than usual, because it's the one thing we can do. Is there anything else people can do just to protect themselves?
Give way to people. Never. I always. I have kind of a mantra as well. Is part of being outdoors. It's really funny. Like in a park or an open space, it's a lot easier to say hi and smile to somebody than it is on the street. And I always say that never be scared. Never be scared to say hello to somebody that you're seeing in a park or an open space. Making a stranger smile and connecting with a stranger, actually, we know is really good for your well-being. It's one of the five ways to well-being, about connecting, or it's and being outdoors really allows you to do that. So I always say things like, don't be the person that waits for someone to say hello to you. Be the one to say it first. And equally, I say, rather than wait for someone to give way to you, just be the person who stops and lets somebody get past. Absolutely. Some of our parks and green spaces, there's almost kind of like people are flocking to them as well. So that the Licky Hills are a real area of beauty. There's something that we're really, really proud to have in the West Midlands, as are Clent Hills as well. But if you are in a place that's busy, just be sensible and don't just keep powering on as though nobody's there. Just you haven't got to be in a rush to get anywhere. Just if you see somebody coming towards you, there isn't enough space for both of you. Just stop, pause, let them give way. And the more that people do this, other people will be the first to give you way as well. So just like saying hello to somebody, the more you do it, the more other people will do it as well. So absolutely, Holly May, it's the best place to be is outdoors. Obviously, we don't want people meeting up with lots of different people as well from different households. Currently, the rules are you can only have 2 people from different households meeting up outdoors, and actually that's really difficult, because if you're a family, then you have to choose who in the family meets up with somebody else, and that's actually it's not really practical. So it makes sense really just to go out in your bubble, in your household, And I would also say, Birmingham has 591 parks and open spaces. Use this time to discover your own local space. Use this time to find your own local bit of green. So Holly, there is a link, I think it's BBC Parks Find a page. It's on our corporate website. Maybe you could post a link on there if you can, Holly. It's
yeah, sure.
But you can pop in your postcode and find local spaces to you. You don't have to flock to the really popular ones or the ones that are well known. Being in any kind of green space where you're connecting to nature, and there's a lot of nature to connect to right now at this moment in this kind of particular time of year. So yeah, that's the kind of advice I would give. Just that's what I would add to what you've already said.
No, that's fine. I'll pop that link in the chat as well. The other questions we've had are around statistics, which might be quite hard to answer on this call, but we'll give it a go, and if not, we can always respond by email to the people that ask them. So one of the questions is around, are there any recovery details or stats about the 1,000 students who have tested positive? Is that information anywhere? I'm not sure. It might be something that you have to answer offline.
Yeah, I mean, we wouldn't be able to share details absolutely at all of any individuals about their recovery, but probably we could speak to our test and trace data team, Holly. If you follow up with Andy, most likely we might be able to see kind of yeah, if there'd been any death related to that. I'm sure we could find that out, but I think in the main, children don't seem to be as heavily impacted with COVID at all compared to some of our risk groups. Really, like I said earlier, older and male with underlying health conditions, especially from Black and Asian ethnic minority backgrounds. They're the people that suffer the most with COVID, the impact of it. But I think we could go back to our test and trace data team, Holly May, to see if there's any more details we could have, and it probably would be more generic rather than those 1,000 that I referred to in this as well. Obviously, I didn't talk about the university population, so you could add probably another 1,000 plus on for that for those kind of students. Obviously, they're a lot older than 18, so they're not children per se. But yeah, I don't think we couldn't answer that at the moment here.
The person that asked that question, if you are happy to, do you mind popping your email into the chat box? And I can then take your email, find out the answer, and I can then respond to you. Another question, again, is it might be quite hard to answer on here, but we'll give it a go. So this one's from Jane Clark. So a friend who happens to be a teacher yesterday optimistically quoted the latest Zoe app press release, stating that COVID is declining across the UK, saying that the R value is less than 1. So their data apparently is saying the R number is 0.9. But in contrast, the government numbers are saying it's between 1 and 1.2. So sort of the question is, obviously this can be misleading for a lot of people and make COVID perhaps seem not as dangerous as it could be. So how can we get across a balanced view? And I guess, do you know anything about the Zoe app and where that data might come from?
I never heard of it actually, and I would always be minded to kind of go with published data from Public Health England and so forth, and or on our government website. So we're not in a decline yet, unfortunately, from our public health perspective. And we've just had the lockdown implemented, and hopefully that will have an impact on the daily number of cases that we're seeing with COVID-19. And the R value as well, it's a really difficult one. People look to it as kind of like to tell us that we're safe from COVID or we're not, and it's really not as simple as that. The confidence intervals around the R value as well are really important. Some of if you look at the low and the upper end of the R value, they're above 1 as well. So it's I would as a COVID-19 champion, I would be directing people to look at more official stats than that, really, rather than other apps that are kind of popping up.
And if the person that if Jane, if you do want to pop your email in, we'll happily go away, find out a bit more for you, and we can respond, perhaps answering your question. But I think that is all the questions that we've had. Does anybody feel free to come off mute as well. Does anybody have anything they'd like to ask, or any further questions for Hamira? No, and out of curiosity, obviously on the call today we've got 29 people. I don't know if you know how to use like the raise your hand thing on Zoom. That's terribly worded, I do apologise. But just wondering how many sort of head teachers perhaps we have in the call today. We want to just sort of make yourself aware on chat or anything like that. No. Okay, well I think that's 1, 2.
Can I just say something? It's Carol Gordon. Can I just say something? It's about the Zoe app. It's called the COVID Symptoms Study app. It's a highly respected app. About over 4 million people in the UK have contributed to it, and I'm one. daily we go onto it and very simply put in whether we are feeling well that day, in which case that's all we do every day. And if we say we're feeling unwell, then there's about 15 questions we have to answer. And we also log our test status, whether we've had tests or not. I can't remember, it's run by one of the universities in London, and it's a very respected department, and Professor Tim Spector heads it up. And it's supported by a research company called Zoe, which is why it's called the Zoe app. And I can give you the details if you like, but what they do is they base their stats on those people. In Birmingham, there's about 9,000 people who submit to it every day, and they base their, but also I think on the ONS stats. And so it's very thoughtful academic prediction of how things were like yesterday. And so their stats tends to be a bit ahead of the government stats that take about 6 days to come through. I hope that helps clarify that a bit. It's not a rogue app, it's highly respected, and I was just happened to come across it, and I've been using it now since March or April.
Thank you, Carol.
I really learned something today, but I'd still kind of, I think if it's saying things like, you know, the R value's going down, I think it's a bit, I'm always on the cautious side of things, I guess, in terms of
what they said was he gives a weekly 5-minute spiel, Professor Tim Spector, and he said that nationally the R number, and this was on the 11th of November, and so May time, but sadly
Carol,
he did say that in the Midlands it is not. Nationally, the average is going down, but in the Midlands, it was still above 1.
Carol, can I just answer my question? The Zoe app is people who volunteer and report to it. They report symptoms, they report positive tests. The ONS data, which is the data that I quoted with the R number of 1 to 1.2, is a random sample of people. So there's two differences, but I don't think, as has been illustrated by this conference, people don't understand the differences. So the ONS data is more likely to pick up the random population and what's happening with asymptomatic folk. And by virtue of the nature that it's a telephone app, Zoe is going to have a biased population reporting into it. But I'm concerned that this data gets published in the press and is quoted. And as I say, it wasn't just a teacher, it was actually a head teacher of a local secondary school who quoted it. And I had to go away because I hadn't got the confidence to sort of challenge him. I had to go away and look at the two lots of data to actually see, well, I think this is, you know, there's a difference. And that's what needs to get across. And that's what I don't think is being got across in the press.
I guess to follow on from that as well, it's how the data is collected will be very important in terms of how reliable that information is. So obviously Jane just highlighted that there could be some bias. I mean, obviously there's bias probably with all data if you really want to scrutinise it, but some more than others. It might be worth, and what I will do is I'll speak to Justin. It would be interesting to get his opinion perhaps on this. How perhaps why he sees, I guess, you know, if he sees, you know, the Zoe app as being particularly important compared to perhaps the ONS data, it would just be good to get his opinion. And I agree that having these discrepancies in the media is very confusing. It's confusing for us as, you know, as public health staff. It's confusing for the public as well, and ultimately it's frustrating because people will read that and think, oh, you know, everything's fantastic, but, you know, actually there's a lot of work to be done. So it's a great question that you've raised, Jane, and I will get an answer for you. If you would be so kind as to put your email in the chat box, that'd be amazing.
Say one more thing, that the Zoe app, the data that they have is shared daily. The data that we put into the app is shared daily with researchers at King's College London and with the NHS, is what it says.
So just to kind of add to the so really interesting discussion, and you know, and this, I guess, I don't want to use the word concern, but you know, I think it was Jane possibly who was pointing out some of the biases around this as well. And it's obviously it's volunteers who are putting forward their data. We know that people who volunteer for surveys and so forth as well are not always, you know, can be slightly different to the rest of the population. Not that we shouldn't do it, you know. I'm not saying at all that this shouldn't exist, but I do think we have to be really careful. And I accept that this is a professor of, you know, within an established academic institution, but even at that level, people differ on their opinions about what is right and wrong. There's still a huge debate within public health about whether people should be wearing face masks or not, you know, in terms of the evidence base and so forth. So it's not always as clear cut as that, just because an academic institution is kind of pushing a certain message.
I've had the same concerns. I've had the same concerns about bias, but in a way I'm encouraged, because I think the people who are doing the app are probably more likely to be, in quotes, good citizens. And so whatever the stats are that they're giving, you know, it's not going to be too much. I've lost the thread of what I'm saying now. But I agree. I think there's the potential for bias there, but I think it's useful.
I mean, yeah, absolutely. That data, I mean, it's fantastic that there's other data as well as the ONS data. I guess it'd be good to understand perhaps more about if it's representative of the population. And I guess if we just get Justin's perhaps view on it, that'd be really, really helpful as well. Conscious that we're going slightly over 10 a.m. Does anybody have any other questions I'd like to raise? No? Well, thank you once again for joining us very early on a Monday. It's absolutely wonderful to see you all. We will, as we always do, send out this video by email and put it onto our YouTube channel as well. And we'll send you the weekly dashboard as well as any other updates that we think might be useful for you guys. Thank you so much. Lovely to meet you. And yeah, we'll speak to you soon. Take care.
Bye. Thanks, Colleen.
Thank you.